The asbestos issue is not a thing of the past. It continues to this day.
We want to end this man-made disaster.
So let's ban asbestos.
So I'm going to shift gears a little bit and talk about this from a more medical aspect. All right, so those of you who have been exposed to asbestos, those of us who have been exposed to asbestos ask, okay, so now what? The occupations at high risk for asbestos exposure are well known to everyone in this room. They include workers in the construction trades, insulators, sheet metal workers, pipe fitters, boiler makers, electricians, painters, plasterers, plumbers, tile setters, roofers, electricians. In the industrial sector, asbestos cement workers, textile workers, shipyard workers, oil refinery workers, maintenance workers, pulp and paper mill workers, chemical manufacturing workers, power plant workers, and many others. Railroad workers, garage and brake mechanics, asbestos miners and millers, talc miners and millers, occupants and workers in public buildings, housewives, house husbands. What about non-occupational asbestos exposure? Household contacts of asbestos workers, exposure from home renovation and repair work, consumers of asbestos-contaminated products such as talc, talcum powder, hair dryers, toasters, heat-resistant gloves and burner pads, vermiculite, and many, many other products. If you've been exposed to asbestos, I think one of the first, as a physician who sees patients and also who does medical legal work, it's important, very important, to document the details of your exposure. Document those details from your own memory with the help of coworkers. Go to members of your union, health and safety people in your union, with the help of an attorney if you have sought legal advice and assistance, written educational materials, materials on the internet, materials from industrial hygiene surveys from your workplace, if there are any, most often not, but sometimes there are. What details should you be concerned about? First of all, what was your dose of asbestos? We know that dose equals intensity of exposure plus duration of exposure. And even though you may not have specific monitoring data, in fact, you probably won't have specific monitoring data, you can look at the intensity of your exposure and the number of years that you were exposed and get some idea of what your dose was in a general ballpark. Secondly, clinical manifestation of disease is a function of latency. What is latency? Latency is the period of time that elapses between your initial exposure to asbestos and the clinical manifestation of disease. It's not when it starts, it's when you know that you have it and it has been diagnosed. Secondly, understand the potential health consequences of your exposure. These health consequences are both non-malignant and malignant. Non-malignant adverse health effects are asbestosis, asbestos-related pleural plaques, and diffuse pleural thickening. Malignant health effects of asbestos exposure are, first of all, cancer of the lung and malignant mesothelioma. These were the earliest recognized, but also cancer of the larynx and cancer of the ovary. These two were added to the list of asbestos-related carcinogens by IARC in its 2012 100C monograph. There are a number of articles in the literature indicating a causal relationship between occupational exposure to asbestos and cancer of the esophagus and colorectal cancer. Now that you have documented the details of your exposure and gained familiarity with the potential health consequences, you're ready to sit down and try to make some assessment of your own health risk associated with your asbestos exposure. Risk is directly related to dose. Asbestosis on two ends of the spectrum, asbestosis is generally thought to be associated with higher levels of exposure, whereas for malignant mesothelioma on the other end of the spectrum, even very low doses of asbestos can cause malignant mesothelioma. They may be doses so small, so minuscule that you're not even aware of them. The timing of disease manifestation, that is the clinical manifestation of disease, as I said earlier, is related to latency. For asbestosis and pleural plaques, the latency is generally 20 to 40 years or thereabouts. For cancer of the lung, larynx, and ovary, the same thing is true. For cancer of malignant mesothelioma, on the other hand, as most of you in this room know, the latency period is much longer, can be 30 to 40 to 50 years or more. Once you have documented the details of your exposure, gained for yourself some understanding of the health consequences of this exposure, and made some attempt to assess your own risk, then it's time to go and see your doctor. You may go see your doctor for screening for asbestos-related disease if you are asymptomatic. On the other hand, you may go to your doctor for diagnosis of asbestos-related disease if you have developed symptoms. This is Dr. Harriet, I knew I was going to do that. This is Dr. Alice Hamilton, who is the so-called mother of occupational medicine. And in her autobiography, she wrote quite eloquently, which was published in 1940. It was published in 43, but she did her work in the early 1900s. And she describes very well the importance and details of the occupational history. So the first thing that your doctor should do when you go to see him or her is take a detailed occupational and environmental history. Because asbestos disease has long latency and because asbestos fibers tend to be retained in the body over time and cumulative dose is important, a detailed chronologic lifetime work history should be taken by your physician. Both direct and bystander exposures are important. The use of respiratory protection, yes or no, is important. Adequate respiratory protection, yes or no, is also important. The adequacy of ventilation in the work area affects exposure. The occupations of a father and other household members who may have brought asbestos dust home on work clothes. And then the presence of asbestos in the home, so boiler in the basement or some other source. Screening for non-malignant asbestos-related disease involves first an occupational and environmental history, secondly a medical history. Are there other, should you discover something, are there other potential causes? Next, a physical examination, chest x-ray and or high-resolution chest CT scan, and spirometry. So this is for screening, oops, pressed the wrong button. So this is for screening for non-malignant disease. Okay, what about screening for malignant disease? If you're concerned about lung cancer, low-dose chest CT scan screening has been shown to be effective, as Dr. Markowitz spoke about earlier today. For cancer of, and it is an accepted screening method for lung cancer. For cancer of the larynx, ovary, and esophagus, to my knowledge, there are no evidence-based guidelines for screening for these cancers. Colorectal cancer, colonoscopy is an accepted screening method for colorectal cancer. For malignant mesothelioma, unfortunately, there is no screening that has been shown to be effective. There are certain biomarkers that have been investigated. These include soluble mesothelium-related protein, or SMRP, and osteopontin. But neither of these is ready for prime time. Let's talk a little bit about symptoms. If you're asymptomatic, you're going for screening. If you're symptomatic, you're going for diagnostic workup. So what symptoms should be of concern? Well, for asbestosis, cough, gradual onset shortness of breath, wheeze, maybe not, are symptoms that could be consistent with asbestosis. For pleural plaques, there usually are no symptoms. For lung cancer, you can have cough, you can have coughing of blood, unexplained chest pain. Neurologic symptoms may be the first manifestation of lung cancer as a result of metastasis of the lung cancer to the brain. For larynx, persistent hoarseness. for cancer of the ovary, nonspecific abdominal and pelvic pain, for cancer of the esophagus, difficulty swallowing, for colorectal cancer, change in bowel habits. For malignant mesothelioma, there are no early symptoms. If you become symptomatic from malignant mesothelioma, it means that the disease is clinically manifest, usually with a very large pleural effusion on chest x-ray. So worrisome symptoms are if you develop fairly abrupt onset in shortness of breath, particularly shortness of breath with exertion, cough, unexplained chest pain or chest discomfort. With a history of asbestos exposure, do not attribute symptoms to aging. I've seen a number of patients who come in, they're short of breath. Why do you think? Well, I'm getting older. That's not an acceptable explanation if you've had asbestos exposure. Now, diagnostic workup of symptoms, if you have shortness of breath that's gradual in onset, consistent with asbestosis, first of all, a chest x-ray and a NIOSH-B read. If the chest x-ray is equivocal for presence or absence of disease, then HRCT would be the next step. Lung function testing for diagnostic workup should include spirometry, lung volumes, and a DLCO, that single breath diffusion capacity for carbon monoxide. Detailed medical history, physical examination, and if the workup shows pulmonary fibrosis, in some cases you may need a biopsy to rule out other causes, in some cases not. For diagnostic workup of coughing of blood or unexplained chest pain, which might be an indication of lung cancer, chest x-ray would be the first step. Whether the chest x-ray is negative or positive doesn't matter, so maybe you could skip the chest x-ray altogether. You would need to go on to a chest CT scan. And in this case, if you've got somebody who is symptomatic coughing up blood, you would have a conventional CT scan with contrast, not a low-dose chest CT scan screening. Depending on what the CT scan shows, you may need a PET scan, which is a glucose-containing radioactive tracer that shows evidence of hypermetabolic activity consistent with cancer or infection. You may need bronchoscopy to get lung washings for cytology, and then ultimately you may need a biopsy for diagnosis. For persistent hoarseness, worrisome for cancer of the larynx, the first diagnostic test is laryngoscopy. Trouble swallowing, a barium swallow and or upper endoscopy would be the next step. And for change in bowel habits where colorectal cancer may be the culprit, colonoscopy. For abrupt onset of shortness of breath, otherwise unexplained chest and or shoulder or back discomfort, a chest x-ray right away. It can be gotten right away. And with malignant mesothelioma, the chest x-ray almost always shows a very large pleural effusion. And if that's the case, then the next step would be thoracentesis and a chest CT scan. You need both. If the chest x-ray is, no matter what the chest x-ray shows, you probably should go on for a chest CT scan. If the CT scan is abnormal, then the next step is video-assisted thoracoscopy or VATS with examination of the pleural space or the peritoneal space, in which case you would do laparoscopy and not thoracoscopy, and biopsy. I've seen many cases where the video-assisted thoracoscopy or laparoscopy were delayed for one reason or another, and there's no excuse for that if you have someone who has asbestos exposure and those symptoms. Now, having had a diagnosis of an asbestos-related disease made, there are things that you can do to reduce other risk factors. You can do these whether or not the diagnosis shows evidence of asbestos-related disease. These steps include see your doctor in a timely fashion for symptoms. As I said, if you get short of breath, don't think it's related to your age. Stay Stay up to date on flu and pneumovax vaccinations, very important. Healthy diet, exercise, get a good night's sleep. I know these are things that our mothers and fathers tell us to do, but it actually is a good idea, especially when you're at risk for disease. You know you're at risk for disease. And most importantly, and this is particularly with regard to lung cancer, stop smoking. If you are a smoker, stop. This was put out by the Surgeon General in fairly recently, I think 2012. Anyway, it lists the cancers that are associated with cigarette smoking. And among them are cancer of the lung, obviously, and we know that asbestos and cigarette smoke act in a multiplicative fashion to increase the risk for lung cancer. Cancer of the larynx, we know that asbestos and cigarette smoke act in an additive manner to increase the risk for cancer of the larynx. And I think those are the major ones where there is overlap. Kidney, cigarette smoking causes kidney cancer. There's evidence that asbestos also causes kidney cancer. And with that, thank you very much for your attention, and thanks to ADAO for its good work. Thank you.